Podiatry Room. Interesting that you picked that up.
Oh.
Yeah, so this is the Podiatry Room. As you will see, we don't have any patients here today. But in this room, people get foot care. So that foot care may range from foot screening for complications of diabetes, screening for abnormalities like corns and bunions, ingrown toenails, looking at people's shoes, advising them on suitable footwear, etc. And these are just some like tools and instruments that we use. So for example, we would do checking of things like the circulation through touching. This is a Doppler ultrasound, so you can actually hear like the pulses. Anesthesiometer and monofilus. These are all what we call sensory testing tools to see if there's any evidence of nerve damage. The interesting thing about the diabetic foot is that if you have a person who has an ulcer, first of all, the ulcer is going to take longer to heal because the diabetes, especially if the diabetes is not well controlled, or if the person has poor circulation. So it means that the care can actually become kind of intensive, and you know the amount of time. So when the hair is busy, and hair is very busy, okay. You know, we have, I think, the right tools to kind of manage most of our foot ulcers, and even in cases that we have that might be challenging, we have a lot of partnerships throughout Barbados in the community. So we have like good access to vascular advice, surgical advice, you know, correcting things with the circulation, etc. So we have a lot of good contacts and resources in the community. And then, of course, even if somebody has an amputation, is to remember that life doesn't end at an amputation. You don't want an amputation, but even if the person has an amputation, your aim needs to be to get them going quickly, making sure you lower their risk of the contralateral amputation, that they don't have a problem with their stump site, etc. So we do have amputees as well who come here for ongoing care, okay? I could go on forever about feet, so I won't. But just to understand that it is actually a very kind of busy thing. And if you go to QH and you see the people with the bandages, you can see, you know, the kind of load that we deal with in terms of the diabetic foot in Barbados.